We're here today to talk about our continuing collaborative effort to combat the abuse and use of opioids and heroin in Cuyahoga County. It was 1 year ago today that the people that you see who were up here, our organizations, had our summit at the Cleveland Clinic, the Heroin Summit. And about 700 people turned out that day to discuss how we could work together as a community to turn the tide on the heroin and opioid epidemic. We were adamant about that day that we were more than just talking, that we had to be about action. And we set about to find a set of solutions that day of the summit. It had to serve that set of solutions not just as an end, but really as a starting point, a working plan that we could all work on together in order to push back on this problem. And what we came up with was something that you've all seen called the Cuyahoga County Community Action Plan. And it looked at this problem really from a multifaceted approach, from law enforcement, from treatment, from prevention and education, to healthcare policy. We looked at really each and every different aspect of this problem to try to come up with a comprehensive solution. And you're going to see that actually an example of that in action here today, because after we're finished going through and updating you on the progress of the actual year-long effort, we're going to hear from Dr. Gilson, our medical examiner, about a real-time problem in our community that's both a problem with a bad batch of heroin, fentanyl, pink heroin that's out there potentially killing people, but also from a medical standpoint, how we need to be, from a public health standpoint, on alert about that. So we came up with all these different ideas and approaches, and we set about making changes, real changes, in those areas that we thought could help our community to stem the tide of death and addiction that was coming out of this problem. Whether that meant getting the heroin antidote, we have Joan Papp here, naloxone, into the hands of first responders and family members, or changing the way that heroin overdose death scenes were investigated, making them into crime scenes. And Gary Gingell was the pioneer in making sure that we had a protocol for that. And the Sheriff's Department, Sheriff Bova, and County Executive Fitzgerald have been leaders in the county on that. Today, we are giving you an update. And it's just an update, not an end. We're releasing a report today that talks about the progress and the concrete steps that we have been able to accomplish in the last year since we met at the Cleveland Clinic. And this report's going to be divided up. You'll see it's divided up into the different parts, the different approaches, whether that's law enforcement, whether that's treatment, whether that's education, whether that's prevention. All the things in this report are the concrete accomplishments and steps that we've been able to make. And I want to tell you something, this report isn't things that I've been able to do, because the vast majority of things that are being done in this space are not being done by my office. They're being done by all the different partners who are here, who are working in their specific disciplines in a collaborative and coordinated way to make this problem less of a problem. I'm going to give you a few examples of, in the law enforcement sphere, some of the things that we have been able to do, even though we remember it's not just a law enforcement approach that we have to take. So in our office, Joe Pena is here. In our office, we've been able to work with the DEA and the FBI and the Cleveland Police Department under Commander Gingell's leadership and under the Northern Ohio Law Enforcement Task Force. And we've been able to make several cases where we can prove that a specific dealer sold heroin that resulted in the death of a particular person. So earlier this autumn, we got a guilty plea with an agreed upon 20-year mandatory minimum sentence for Sierra Snowball, who sold heroin laced with fentanyl, the kind we're going to hear about later today. That's the case, and we've seen several of those, where the drug dealer carried a cell phone and was a dangerous drug dealing member of the community. But we also have other dangers. Drug dealers don't just carry cell phones. Unfortunately, we found that sometimes they carry stethoscopes. And our office, working with the DEA, the diversion squad that Denise heads, have been able to now indict and charge and pursue several cases of physicians who have been dealing narcotics, using prescriptions and abusing their prescription power to send tens or hundreds of thousands of doses of addicted opioids out into our community, where they have just as serious of effect on the community in terms of death and addiction. We have worked, as I said, together to establish a law enforcement protocol with the county prosecutor's office, and Prosecutor McGinty has been a leader on this in prosecuting these cases and investigating these cases. Deb Naiman, who works for Dwayne, has been a leader on this. Commander Gingell has been a leader on this. Sheriff Bova, making sure that when police officers roll up on the scene and they see somebody who's dead from a heroin overdose or addiction, they don't just take off and consider it a death scene. They treat it like a crime scene. They look at the cell phone to see if we can't trace immediate leads. They preserve the evidence, whether that's a syringe or a band on the scene, to see if there's DNA that can be picked up. And they interview the witnesses who may be right on the scene, who can lead us to the drug dealers and up the chain so that we can hold somebody accountable for how this has happened. I will tell you that one of the greatest successes that I see that has happened to the people here in this issue is the ability to raise public awareness on the heroin issue. We've gone from a place where there were many communities who we would approach and they just had their head in the sand. This is not a problem here. You must be confusing us with another suburb, with another city. We don't have heroin. To places where we have had many community meetings and many educational sessions at places ranging from schools to Judge Mattia and Joe Pinu and I, we're at one of the most prominent law firms in the nation talking about this problem earlier this week. And we owe people like Prosecutor McGinty, like Judge Mattia, like Judge Astrap, who's here, like Aaron Marks, and like Bill Denahan at the Adams Board, a great debt of thanks for stepping up and conducting a first-class and world-class public relations effort to make sure people know about the dangers that are being presented, that are presented by heroin addiction and use. So those are just a very few of the concrete successes that the people here are actually responsible for. I'm certainly not. We need to say one thing: this is really not a victory lap. This is a check-in point. The bell lap is still ahead of us. We know, and the elephant in this room is that heroin deaths in this county are not subsiding. They are continuing along at a torrid pace despite all our work and all our effort, and we are not going to stop for 1 second or slow down in our efforts to combat them. It would be even worse this year than it was last year if it weren't for Dr. Papp and the efforts and successes we've had in naloxone. We've had many lives were saved in our county and in our state because of those efforts. But we need to take a really hard look at what more we can do in the future, because it's not just a number of hundreds of deaths, and Attorney General DeWine has talked about this. It is every single person who dies. Everyone is a son, father, daughter, sister, brother, one less person at the dinner table, one more child who doesn't have a parent. These are tragedies occurring in our midst every single day. And it is up to the people that you see here behind me and their organizations to help us all to see if we can improve that. So now I'd like to turn it over to our county executive, Ed Fitzgerald. Ed and I can't remember the first time we met alone about this heroin problem, but from that day on, he has been all in our county for all the right reasons, trying to help to save lives. I cannot thank him enough for his efforts. It's been a truly incredible collaboration. So Ed, microphone's all yours.
Thank you. Thank you very much, Mr. Dettelbach. This is another example of the way that the county is working with the U.S. Attorney's Office. It went from an interesting adversarial relationship prior to us being there to something that's been very cooperative on very important public policy issues, and this is one example of that. So we're very happy to be part of this heroin initiative. It was 2 years ago, actually. It was back in 2012 that the county really started looking at things that we could do on our own. We started a heroin initiative of our own back in 2012, and then under the leadership of Mr. Dettelbach, we formed this more broad-based coalition, and you see it represented to you here today. I'd just follow up briefly on what Mr. Dettelbach said. We certainly are not congratulating ourselves. We're just reinforcing that we are treating this as a public health emergency, that we understand that it's more than just a social services problem, it's more than a human services problem, it's more than a law enforcement problem, that it has to be dealt with as a public health emergency, and everybody has to be on board and all hands on deck in order to respond to it. We've been trying to do that for the last year. We have seen a number of successful interventions. I just want to mention a few things, but again, one of the things that's unique about this particular problem is that it can't be categorized as a problem for a certain subset of people or a certain part of town. It crosses all demographic lines and geographic lines all over the state and all over this community, and that's why it's so important that we have a broad-based approach to try to address it. A couple of things that we've seen that have been effective. One is the prescription drug drop-off program that the county has been spearheading. Last week, we passed an important milestone. By the way, we have about 42 communities in Cuyahoga County. Out of 59 communities, we have about 42 communities where we have prescription drug drop-off points. As of last week, we reached an important milestone. 10,000 pounds of prescription drugs have been turned in at those drop-off points. Just think of that, 10,000 pounds. You think about the number of doses that would represent in terms of the harm that that could do, whether it's children getting access to those or people intentionally misusing those drugs. That's a staggering number, and that was as a result of a lot of hard work, folks from the county that were working on that. Just to put the scope of this problem in some perspective, from 1999 to 2011, it was estimated that there was a 440% increase in overdose deaths. Last year, we estimated that there were 194 heroin-related deaths just in Cuyahoga County. Now, we have started to see things level off, and at the mid-year point of 2014, we had shown a 7% decrease. But look, this is very incremental. And it is certainly not something where we can congratulate ourselves because the number is still far, far too high. We do know, though, that some of our interventions are working. U.S. Attorney Dettelbach had mentioned the naloxone programs, and I just want to, again, compliment everybody that's been working in that Project Dawn initiative, which, for those of you that don't know, stands for Deaths Avoided with Naloxone. Our estimate is that just in 2013, there were 31 overdoses that were prevented, fatalities that were prevented because of the administration of naloxone. Just this year, there were 57. Now, the overall number of heroin overdoses has gone down, so you can see that I believe the distribution of naloxone is continuing to expand, and that's a good thing. The county has tried to help with that with providing funding, but we've also built relationships with local law enforcement. So it was a few months ago that we announced a partnership that we have with WEB, which is the West Shore Enforcement Bureau, where we're making sure that the training and the funds and those resources are available to local law enforcement. We've also done that with our own sheriff's department. So our first responders within our own sheriff's department are now have that training to and resources to administer naloxone as well. That's done through our impact unit. I'd also mention that our impact unit, which is kind of our community policing unit, has really been focusing on providing additional resources and training when it comes to our community's response to the heroin crisis. I would just close by saying that all of us here today know that we still have a lot of work to do. As Mr. Dettelbach mentioned, we have to keep reinforcing this message. If we had had a press conference in 2012 and 2013 and said and sounded the alarm and then disappeared for the next year or two, we wouldn't be doing our job. I want to thank folks from the media, by the way, for your coverage of this, because part of it has to do with public communication. You're going to hear at the end of this event here today some recent developments with fentanyl and some things that the public needs to be aware of. Some substances that are even more dangerous and more deadly than typical heroin, as hard as that is to be believed. But we have to continue to mark these benchmarks, and we have to listen to the public. If there are additional things that we should be doing, we want to hear those suggestions. But we're off to a good start because we built a broad-based coalition. The folks that you see here behind me representing various entities in the community have been responding. They know that it's a moral duty as well as our legal duty to try to address this. And we are marking another day and another anniversary. We still haven't gotten to where we want to be, but we're continuing to make steady progress. In the county, in all of its forms, whether it's the executive branch, our folks in law enforcement, great judges like Judge Mattia, who've been leaders on this issue, in the judiciary, we're going to continue to play our part as well.
That solving the heroin epidemic in our community will continue to require a collaboration amongst doctors, law enforcement, treatment professionals, legislators, and educators in order to effect change in this area. As healthcare providers, it's our role to work with these partners on educating them about the most cost-effective and evidence-based treatment approaches, the best practices, if you will, that can make an impact on this. If we are able to say at the end of the year, that the number of overdose deaths in this county has remained unchanged, I think we will have achieved a great victory. Let's not forget that over the last 6 years, that rise had been steady. And to stem the tide of the rise in overdose deaths would be definitely a victory, and one that I'm confident that this group has played a significant role in. We have spent numerous hours as a group working with state and federal legislators on talking to them about the science of addiction and treatment, and helping them to make well-educated decisions about some of the proposed legislation that they've put forth. Several of our recommendations have been incorporated into proposed legislation, so I think it's apparent that the legislators are listening to our concerns and responding accordingly. Dispelling the many myths that surround the disease of addiction and its treatment are of the utmost concern. Misinformation is rampant within the medical community as much as it is within the lay public, and so we've been spending time talking not just to groups out there in the community, but also to doctors and nurses as well. The members of this working group have, in fact, logged over 100 hours of talks in the community and with professional groups regarding multiple facets of the opiate addiction and treatment in an effort to dispel misinformation surrounding this disease. Moving forward,
Should that may just be Astrab alone?
right, exactly, and that's not including Judge Astrab's contribution. So moving forward, we will need to expand upon this year's success. We need to focus on what best practices look like. Who are the programs that are doing things right, and how can we expand those programs to reach more folks in Ohio? This will require ongoing collaboration between physicians and other treatment providers and legislators and drug courts. Our collaborative efforts are working. I don't think there's any doubt in that. The fact that more people haven't died this year compared with last, I do believe is a victory, although not the ultimate victory. But we're not content with this. We need to keep pushing to decrease that number, as even one overdose death is a tragedy. I have no doubt that we can and will accomplish more in the upcoming year and years. Thank you.
One of the challenges that we realized early on is a true lack of capacity. We found out that people were going to detox and saying, I want service, and saying they need to wait 2 weeks. We know if we go to a hospital, we have a broken arm, that'll be treated that day. We also know that that addiction needs longer environment of a sober environment. And be happy to know that we're putting money into residential beds that will practice the best practice for 15 beds that will be in the community for males. We also are going to be using sober beds for individuals that need a longer term. Our funding for residential beds goes 30 days, sometimes 60 days. Folks need between 3, 6, and 9, maybe even 12 months to recover in a sober environment, as opposed to going home or back where they came from. And and decompensate. So those are critical issues for us. This scratches the surface of what we need, but we have begun to redefine our priorities in the Adams Board and have refunded a number of areas, and these are the areas we're concentrating on. This saved lives, and I appreciate the engagement we've had in this community, and as Steve Dettelbach has said, this is the beginning, it's not the middle, it's not the end. Thank you very much.
Thank you, Bill.
Thank you, Steve. And before I started, I just wanted to say thanks to my outgoing boss, Ed Fitzgerald, who gave me the opportunity to act in what I think some people would regard as a very non-traditional role for a medical examiner. But it has been one of my passions to pursue public health, and thank you for that opportunity. At the end of last week, we became aware from a bulletin that came from Lorain County about a drug that was being sold as pink heroin. It is not heroin, it's fentanyl, and if you remember from earlier this year, we had an outbreak of fentanyl distribution in our county that resulted in 3 deaths and a number of non-fatal overdoses as well. To the east of us, Pittsburgh had an outbreak of fentanyl shortly before that resulted in 22 deaths. So whenever fentanyl is mentioned, we take it very seriously, and Commander Gingell and the Sheriff Bova had been on the lookout for potential problems arising from this pink heroin showing up so close to us in Lorain County. Over the weekend, we had a couple of overdose deaths, which unfortunately is not an unusual event in my office, but early this week, the testing preliminarily came back and showed that fentanyl was present. We could not link them to pink heroin, pink fentanyl, because nothing was found at the death scenes where this had occurred. But as of this morning, working with Cleveland Police, we were able to identify that this product is now in our county. And what I'd like to stress today is that fentanyl is a very, very potent drug. It's used as an anesthetic for people undergoing heart surgery. It is far more potent and far more lethal than heroin. Estimates are somewhere between 20 to 40 times the potency of heroin. So it is a drug that, if it is sold as heroin, has a lot of potential to be misused and fatal. And what we'd like to alert the public to, and Mike Tobin has some flyers, and we'll put the image up on the website at the medical examiner's office, is that this drug, which is sold as a pink kind of rock-like substance, is in our community, and it's not something to be pursued. It's a fatal, bad actor that needs to be stayed away from, and hopefully it goes away with the lack of, response to, or the response to this, the lack of demand for this is what I'm trying to say. This is an immediate threat to public health. Pink heroin is not heroin, it's fentanyl. If it's sold as pink heroin or it's sold as pink crack, it is not. It's a fatal form of fatal drug.